If I see a patient in the office and diagnose strep throat and give them penicillin, and either the mom or the patient themselves calls and tells me that they developed a rash, there is zero question. The chart now states they have an allergy to penicillin and will never be given it again. Why don't we believe parents and patients when they tell us they have had an adverse event regarding a vaccine? It doesn't make sense to me as a medical professional. Why do the placebos in vaccine studies contain the adjuvants like mercury and aluminum? Aren't placebos supposed to be inert? In other words, if you're comparing, let's say, the hepatitis B vaccine against the placebo, why does the placebo contain a metal? If the concern could possibly be the metal itself that's triggering the autoimmunity. Number 8, why has the rate of autism spectrum disorder gone from 1 in 1,000 in 1990, as I was taught, to 1 in 48 in 2017? So let me focus just a few minutes on informed consent. I want to make sure that my patients and all patients are fully aware of risks versus the benefits before undergoing any medical procedure, not just vaccination. Nobody should have to undergo an irreversible medical procedure unless they agree to it. And patients should not be dismissed from practices for choosing to decline a vaccine that's irresponsible on the part of the medical professionals. We need to take care of all patients, not just select few that agree with our position. Employees should not have to receive a medical intervention in order to keep their job. And the big question that I have is, why are we not protected under the Geneva Convention? So to me, the idea of forcing a medical intervention on someone without their consent goes dramatically against the Geneva Convention. And to me, moves to the point that it's an incredibly slippery slope, folks. Are women going to be forced to undergo a mammogram or a pap smear in order to keep their jobs? Are men going to be dismissed from medical practices because they refuse a digital rectal exam or a PSA for prostate cancer screening or a colonoscopy at age 50 for screening for colon cancer? Where does it begin and where does it end? There is much work to be done in this area, as pharma is literally racing to provide us with more life-saving vaccines. Let me tell you, friends, they are working on over 140 vaccines at this time. Beware. This is coming. Throughout 2017, I have received a tremendous outpouring of support from literally all over the world. I just want to say thank you to everyone for helping me keep my chin up during a difficult year. What I now realize that this has been the kick in the behind that I personally needed to get out from under a multi-billion-dollar conglomerate in order to really do the work that I feel needs to be done, both in educating the public and taking care of my patients that have any chronic disease, but in the way that I really feel they need to be treated, not based on protocols and not under the thumb of a watchful eye telling me I must do this or do that or risk termination. And I will begin realizing that dream this coming Monday on January 15th when my new medical practice, Inspire Wellness, opens in Beechwood, Ohio. I will continue to fight for the rights of all patients, including the right to informed consent. And along with that, we must push to uncover the truths around vaccines, the real safety and efficacy data, not the ones that either the government or Big Pharma wants us to see that is really not the truth about what's going on regarding their safety and efficacy. And as I learned when I first stepped into the Wellness Institute, be open to new ways of thinking, and that's what we all need to do in medicine moving forward. I thank you for your time and good luck.